Welcome to the Aesthetic Talk, the premier podcast for aesthetic professionals around the world. I'm your host, Jonathan McLean. I'm the proud founder of elite aesthetic healthcare recruiting firm, McLean Aesthetics, connecting the best talent with leading med spas, dermatology, and plastic surgery offices nationwide. On this show, you'll hear from industry experts, medical professionals, and CEOs as they share their journey, provide insight on the latest trends, and offer invaluable advice. To ensure you don't miss out on any of the latest conversation with our experts, subscribe on YouTube and all your favorite podcast platforms.
The Aesthetic Talk Podcast.
I'm your host, Jonathan McLean, and we're back with the Aesthetic Talk. And today we have a special guest on the show. She is an experienced aesthetic injector with over 10 years of experience, located in South Miami. Please help me introduce Jennifer Martinez.
Thank you for having me.
Thank you for being on the show. I'm sure you're going to have a lot of knowledge to give away and a lot of takeaways that people can use because you've been in the industry so long and gained so many nuggets.
Thank you. Yes, I would love to share that with you guys.
Awesome. So I always like to start off by asking my guests to tell me a little bit about how you got into this industry and the road that led you here.
So I am a physician assistant in dermatology. I started back in 2006. When I was in PA school, one of our electives was it was open. We can pretty much pick, and I picked dermatology. I was lucky enough during that elective rotation to get actually hired in dermatology, which is kind of difficult when you first graduate from NP or PA school. So I do get that question a lot. I was actually very lucky to get my first job in dermatology, and that opened up the doors for a lot of good experiences, both in medical and aesthetics.
Yeah, for sure. I can understand that. Being in dermatology, right, it's a lot different than kind of the aesthetic industry. How did you know you wanted to focus on cosmetic dermatology?
I would say that kind of grew over the years. It wasn't initially something I wanted to get into. When I graduated, actually back in 2006, there wasn't a lot of aesthetic companies out. I think that was actually the year that Restylane launched. So it was over almost 20 years ago. It was about 17, 18 years ago. So, the filler industry and all that was starting off. It wasn't as big as it is now. So it wasn't a field that was highly saturated. I actually went into dermatology first because I love to do procedures with my hands. I like to do like minor surgeries and biopsies. And then just over the years practicing in medical dermatology, we were exposed to a lot of lasers and of course, Botox. And then here and there, your patients that have trusted you for over the years start wanting, to dabble into the like fillers and doing more of the aesthetic stuff. And little by little, I kind of started to switch over, and I just really enjoyed the field and giving confidence to women.
Yeah. And that has to be rewarding, right? When people sit in your chair and they're like, hey, you've changed my life just based on what my insecurities that I may have had and thought I couldn't get this fixed, but you were able to do it and really help me to fix my confidence.
Right. That is a nice thing. I feel like a lot of providers are sometimes either timid or scared to get into the aesthetics because they find it a very kind of like a demanding profession, a demanding career. You have clients that are, paying top dollar for their procedures. So they have very high expectations. So I feel in my field, I actually see some colleagues get turned off by that because they say it's very hard to please patients because they're, may have unrealistic expectations. I kind of saw the opposite. I felt if you just make someone, a little bit, more youthful or a little bit more refreshed looking, it really gave patients confidence to feel, if they look good, they felt good. So I saw that early on and really I liked it and enjoyed. It was very rewarding, So I like that feeling.
Yeah, that's good. How did you, I guess you said set patient expectations, right? You've been very successful, right? You've opened your own practice. We're in it right now. It looks amazing. How did you kind of set the expectations for your patients and allow yourself to grow more and more?
I think initially it was something that took me years to kind of master, and I still feel I'm working on that. I think being very honest with patients, recommending procedures that really will benefit them, and making we try to do very holistic, individualized plans for patients. So I think when they come in, we give them our time, our attention. They do know, that we've been in the industry, myself and my partner, for many years. So I feel they value and trust our opinion. And I give them all the options. I tell them what they can do that is non-invasive, what they can do that's injectables. We give them skincare options. We give them laser options. I feel when I first started, I was a lot more shy, or I would be worried about the cost of these procedures. So sometimes I would try to just recommend like one thing, like, oh, we can do one, let's say a syringe of filler. Obviously, one syringe of filler is not going to give you, an amazing result or a facelift type of result. So then I would set myself up almost for failure, because I felt this patient thought, oh, if I'm coming to her and she's, recommending something, it must be that I'm going to, finish the procedure looking very refreshed. But I was very cautious of costs. So I would only tell them one or two things when they came in. Now I feel I'm very upfront and honest with everything they need. I don't do it in a pushy way. So the patient feels okay, they can trust our recommendations. And we give them kind of a regimen and a stepwise approach. Okay, we're going to start maybe today with, a Botox and a filler. When we see you on follow-up, we're going to continue on with a laser. And we always recommend skincare. So I think we kind of do a very thorough job of assessing the patient, doing a very nice consultation, and coming up with packages for them.
And I'm sure that builds like long trust, right? Because if customers coming in, you're constantly just, I'm selling this instead of like educating them or having them believe you because you're telling the truth. Will they come back? Will you have a loyal patient?
Well, I think patients, there's sometimes that we tell a patient they don't need anything. And I think when a patient comes in and they've, let's say, done their lips before, and they come in 6 months later, 9 months later, they're like, I'm here again for my lip filler, follow up. And I give them an honest opinion. It looks great. It's still held up. You really don't need it now. They love that, that I'm not trying to necessarily take their money or just push another syringe on them. And I will give them other options. You don't need this, but let's work on your skin color. Now you have, a little bit of rosacea or some redness. So we will give other kind of complementing procedures that they can do. That doesn't necessarily mean overfilling them. If they think that it only lasts a certain amount of time, sometimes a patient comes in and the filler has actually lasted a lot longer and they don't need that. So I think patients start to trust you, not only from the amount of years you've been, providing care for them, but then when they start to see, okay, she's not always recommending that I need to do this. Sometimes she tells me no, they like that,
Yeah, for sure. Now let's talk SkinLocal, right? You have built not one, but two practices, but potentially your third very soon. Tell us, how did SkinLocal become a concept? And
myself, I'm a PA, and I had a partner, Gina McLean, that's also a dermatology PA. She had been working in the field probably about 10 to 12 years. We both, I think, felt a little burnt out by the medical dermatology practices, or we started to feel that insurances were kind of governing the medication we can give a patient. And we wanted to kind of offer a better experience for the patient. We wanted a patient to come in and feel that they almost didn't want to leave when they come in. What else can I do? Do you guys offer IVs, facials? We kind of had this concept of what we wanted to have a patient feel more than anything when they came to visit us. And honestly, we worked very hard on it for months and months. It probably took us a whole year from the time that we signed our contract to our first storefront being opened. We had lists of things that we wanted to do. We constantly had goals that we set up, short-term and long-term goals. We came up with branding. And I think the branding was very nice, that patients almost wanted to be a part of that SkinLocal community. And it really took off by word of mouth. Patients started to come in. They had good results. They would, go out to lunch or brunches with their friends. Their friends saw the results, wanted to kind of come in and check us out too. And it grew mainly by word of mouth and social media. I feel we did bring in a really good team. Our staff in general has all worked in the aesthetics or dermatology for a long time too. So that has made a big difference too. That even if the patient comes in and they're not seeing myself, they're seeing, a nurse that's here, they're having a weight loss protocol that they're starting, or they're having a facial, that they all have the best experience when they come in. So we really have done a good job of handpicking the best team, honestly.
Yeah. What's your mission, or what's your values behind SkinLocal that allows every customer to have a great experience when they come here?
I think our values and our goals are really for a patient to have a nice experience when they come in, to feel that it is customized and like a boutique type of aesthetic practice when they come in. We want them to also know that we give very natural results. We don't overfill. None of our patients, I feel, look fake or overdone. And that is, I think, very refreshing for patients, when they come in. Because I think one of the fears in aesthetics is not looking yourself or changing too much. I would say in general, patients want to look refreshed. They want to look rejuvenated, but they still want to be true to what they look like. They don't want to change their look too much. So I think when they see that all of our staff looks very well taken care of, that we're all very natural looking, that gives them confidence in our ability, to give them a good outcome.
Yeah. No, I can definitely understand that.
The Aesthetic Talk Podcast.
Hey, Jennifer, now it's time to put you in the hot seat where we ask you trending topics in the industry and you give just your perspective on it. All right.
Okay.
All right. So let's talk about semaglutide. It has been in the news right now. Everybody's taking it. What are your thoughts on it?
So my thoughts are that it's a great medication. I actually was on it myself about 3 years ago before it became very popular because I had a medical condition that I needed it. Of course, one of the side effects was a weight loss. So I had patients begging me to tell them my secret. Of course, I tried to keep it quiet for a good 6 months, and then the cat was out of the bag and we had to kind of share. And we did start a weight loss protocol that we have different peptides and different treatments. We offer IVs and some weight loss medications to get patients to their goals.
Nice. And I see a lot of celebrities trying it. Do you think that's what caused the huge boom in the market?
In Miami, I feel it actually became popular maybe a year or two ago. So almost even before it really got hot in Hollywood. I think just because we're a city that, is into their looks, we're obviously always in bikinis and bathing suits because we're near the beach. So in Miami, I think it got buzz, early on. So back in 2021, it started to, become a hot thing. I think Hollywood maybe took it to the next level where you did see, okay, some people who really needed to be on it, losing weight. But then you also saw, I think, a little bit too much where you can see some celebrities that maybe were already slim and thin and didn't need to overdo it. And I'm seeing, some patients maybe or some celebrities, I would say, maybe looking a little too thin in Hollywood. So I think it may have taken off around the world or the country once it hit Hollywood. But in Miami, I feel like we were kind of onto it very early.
Yeah, so this substance isn't for people that are already thin. It's like, hey, I want to lose extra 10 pounds.
That's not for that patient. They're not the ideal candidate, even though it's hard to get a patient to understand that they don't not need that. They think they need it just for that extra 5 or 10 pounds. But it's really more someone looking to lose, a significant amount of weight.
Gotcha. Now let's talk Daxxify, right? Everybody's talking about it. They say it lasts 6 months. And patients are asking for it. What are your thoughts on it?
So I think there was a big buzz with Daxxify when it first launched. I feel patients in general always seem to be a little bit dissatisfied that the current muscle relaxers on the market just last about 12 weeks. I feel in general, they would want to get longer duration out of it. So when Daxi came out, it was something patients, were constantly asking for. When we brought it into the practice, we were one of the first practices in Miami to have it. They actually sent us to Nashville to launch the product. So I was part of that, one of the early offices that, got to go to Nashville. And I went to the Revance, which is the company that launched Daxi. I was able to, experience that launch. It was great. I feel like the injectors were really excited about it. When we brought it to practice, I feel we got mixed reviews. Some patients were very excited, happy to try it. Once we went over costs and pricing, that it was going to be more, it's probably either about price and a half or 2 times as much. I feel patients held back a little bit. They do have expectations that if they're paying more for a premium product, they do think it should last double the amount of time. In my case, I did it in December and especially my glabella, the frown lines held up really nicely until July. So I got a good 6-7 months out of it. So my experience was great. I have had some patients that are very expressive and have a lot of movement that maybe only get 1 or 2 or 3 months more out of it. So I feel like we're still kind of, playing around with it. So we're still practicing, medicine, what we do. We're kind of figuring it out. I think on some patients, it's lasting longer than others. But I would say in general, I feel for the frown lines, glabella area works great. I think the other areas that are off label, which is crow's feet and forehead, it's still to be determined the correct dose. So I feel like we're still playing around with what is the correct dose to get longevity out of it.
Yeah. So do you think, so it just depends on the person and how long it may last? Right.
I think some patients may only get an extra 2 weeks out of it. And then you may have a patient like me that got an extra 3 months out of it. Yeah. So I would say if I'm paying for double the cost of a product or price and a half, I would want to see a couple months more longevity out of my muscle relaxer. So I think the patient who maybe only got 2 or 3 more weeks out of what they were, previously using, that patient may be a little dissatisfied with the longevity of it.
How do you decide what products to bring to your office?
So in general, we tend to actually carry every single brand. So in my office, I have Daxify, I have Botox, I have Dysport, Javoot, and Xeomin. So we carry all, I believe it's 5 muscle relaxers that are out right now, because we have just a lot of clientele. We see, hundreds of patients a week. So sometimes I have a patient who comes in and asks for a specific product. So I do carry them all. With that being said, that doesn't mean that I use them all evenly. I would say I use a lot of Restylane and Dysport products. So that is my favorite. We do a lot of Botox and Juvederm as well, but we use the RHA line as well. I use Radius, I use Xeomin. We kind of use it all.
Nice. Yeah.
That's
good.
Yeah.
Because a patient could say, hey, I might be interested in this, or I want to come and try this. And you have it. They don't have to say, hey, I want to venture out to somewhere else.
Right. Well, and sometimes we'll have patients come because they know we carry that specific product. So a patient may have been with a practice for years, but they want to try Daxi because it was a new buzz. So they're like, oh, we're here because I want to try Daxi. I've been doing whatever brand, they'll tell you I've been doing Dysport or Botox for the last 10 years, but I came to visit you guys because I know you're one of the first ones to have it in Miami and I want to try it. So we did have some of those patients come over.
Nice. Now, speaking of Hollywood, tell us, what are some Hollywood lasers that are most popular right now in the market?
So I would say, when a celebrity kind of does a treatment or post about it, there's buzz on it and we'll get, either people calling or patients when they come in ask us about it. So a couple of the procedures that have gotten like a buzz and have been hot in Hollywood the last year, I would say, is Morpheus. Morpheus has done a great job, not only marketing, but a lot of the celebrities have done it either on their face or neck, or recently some celebrities have posted about doing it on the body. Like for instance, the abdomen we had, I think it was on Instagram, Kim Kardashian posted her Morpheus treatment that she had done out in LA. And that actually created a lot of buzz even back here in Miami. So we had patients come in like, oh, I want to try the Morpheus on my stomach. So we did get a little, upkick in those kind of sales and patients coming in for other areas like the body when they saw someone like a Kim Kardashian post it. Another laser that gets a lot of buzz in Hollywood because a lot of stars do it even right before the red carpet is one called BBL Moxie, which is by Cyton. So that one is a laser that we brought into the practice last year. We've been using it a lot, getting really nice results. But that one treats reds and browns on the skin. It treats melasma, so pigmentation issues, and fine lines and wrinkles. So that's a nice one as well. And that you will see a lot of celebrities kind of posting about it on Instagram and TikTok and all that. And that has created a buzz as well.
Do patients come in and say, hey, I want to look like this celebrity?
I don't get a lot of that. I think because it's our clientele, it tends to be conservative, more natural looking. But I have had in the past, like you'll have a younger patient come in with like, a picture of a lip. They're like, I want this specific lip. And sometimes you can deliver it to the patient and sometimes you cannot. It's based on their anatomy, what we're working with to start. Sometimes if someone has a Cupid's bow or very large lips, I have to be honest with the patient. I would say, look, I can never get you that result with your anatomy. You have very small lips or you don't have a Cupid's bow, but sometimes we are able to achieve it. So I have some patients, but not a lot that come in with pictures.
Nice. Yeah. It's cool. That's really good. I find it that, being transparent, like you just said with the client, it goes a long way, right? Again, building that trust and them having come back and say, hey, you didn't make me look unnatural, Well,
my favorite thing to hear is a lot of patients will go home and they're like, my husband didn't even notice. And we're like, yes, that's the goal, that you look just better and refreshed, but you can't necessarily tell that there was a change.
Are patients going more back to the natural look now? Is the overfilled look kind of out? Is that?
I would say yes. And you're seeing a lot of that actually on Hollywood now. You're seeing rappers and celebrities that are actually dissolving a lot of fillers. They're reversing their BBLs. That was, a huge thing here in Miami, where they're, I feel like less is more now. So we do a lot of those procedures as well with the BBLs, which is more, it stands for Brazilian butt lift. We don't do surgery here. We do injectables, but that is a trend that we see in Miami a lot, that we are injecting either biostimulators. Usually it's Sculptra or Radius in the buttocks just to enhance skin tone or sometimes volume. But that has been a trend that I would say is decreasing, where it's like less is more. People are doing less filler, less jawline, smaller lips, going more for the natural look. Yeah.
The Aesthetic Talk Podcast.
Now let's transition into our last segment called Ask the Expert, when we ask you questions that viewers already written in about the aesthetic industry.
Okay.
Awesome. So Jane, she has her own med spa. She's a small entrepreneur. She has been injecting in the field for 5 years, and she's looking to really grow sales. Now, one of her questions is she wants to bring on an influencer to market for her. What are your thoughts on that?
So, in my particular experience, I have not used a lot of influencers. I was blessed that I was in the dermatology field for 17 years. So when I did go solely into aesthetics, I did have just patient following in general. But I felt that we were more successful either with word of mouth or even doing like a referral program. Refer a friend, bring your mom, sister, that kind of thing. Influencers, I feel, especially in Miami, can jump around a lot. So we would see like an influencer who, pairs up, let's say with a med spa, they do all their marketing for them. But then like 6 months later, you see them with another, med spa. So I wasn't very like fond of that. So myself personally, I did not use a lot of influencers to bring, patients in. So I can't really give much more advice on that.
So how would you say she does marketing? Do you think more?
So I think word of mouth. I think Instagram, which is a free tool. We've gotten, I would say, most of our, patients kind of flow has been through Instagram. We've started TikTok recently. So TikTok, I think if you're young and you're good at it and you know how to do it, TikTok is a great avenue to bring patients in. What else? Pinterest? Are we? Okay, so I guess Pinterest. I'm talking to our marketing girl here who does a little bit of it. So Pinterest is how we've gotten some people in.
Nice. And I rarely hear anybody talk about Pinterest. So it's an untapped market. And if it's working, that's a good tip right there for sure.
I think with different social medias, you'll get different age groups in. You'll notice, okay, younger people, let's say coming in from TikTok, you'll have maybe a little bit of an older crowd coming in from Facebook. But we do see a little bit of a different crowd coming in from the different social medias. And I think having patients write reviews on Google, you'd be surprised how much Google can actually bring traction into your practice. So updating your pictures on Google has been a big thing, keeping them fresh, updating your hours. If it's holiday hours, those little things will kind of bump you up on searches. And that has helped a lot too.
Those are really good tips. And I would encourage everyone to use those to grow your practice because that's what works.
Right.
For sure. Now we're going to talk about Paris, right? So Paris has been in the industry for 5 years in dermatology, but her clinic doesn't offer any aesthetics, no injectables, things like that. How do you suggest she get some experience in aesthetics?
So we actually just had a group of PAs. I think 2 of them were PAs and one was a nurse practitioner this weekend. Myself and Gina, my partner, hosted a injector session we had on Saturdays. It was a kind of like a one-on-one for Botox and muscle relaxers. And then on Sunday, we did fillers. So we had about 9 people turn out. So it was a small private training. 3 of them were working in a dermatology practice, but only the dermatologist does aesthetics. The PAs do not have the ability to learn or practice. And I was very proud of these mid-levels that they actually took it upon themselves. They invested in themselves. They signed up for the training and paid for the training, and they're, trying to learn it on their own. And I think as a provider gets confidence, they'll be able to convert their medical patients into aesthetic patients.
And that's a good tip, right? Because sometimes your job isn't going to offer something that you want to do, right? And you just can't wait for an employer to say, hey, we're going to actually add aesthetics or injectables to the practice. I'm going to train you. Going out there, having the initiative to say, I'm going to start this on my own. I'm going to invest in myself to learn it and then move from there. It takes a lot, but it's worth it.
Correct. I mean, I was in a practice for 10 years that, yes, we dabbled in it and we did some of it. Some of the aesthetics, but I think until I really said, okay, this year I want to focus on the aesthetics. And I actually sent myself that year. I said, I'm going to invest in myself and I'm going to send myself to this conference. There was a local conference here in Miami, actually in Boca Raton. and it was called Aesthetic Extender Symposium, so AES. Yes, hosted by Christy Lennox, which she's also a colleague, been in the field forever too. When I went there, I was just immersed like in all the, everything of the field. You got to see skincare, you got to see new lasers, fillers, threads, everything that was coming out. And I feel that conference is what really got me going, that I said, I'm not looking back. I'm going to keep going. I'm going to really plan this out. I'm going to, put together plans and certain goals to get to what I need to do to eventually open up my own practice. So I feel like that was the beginning of me getting into like the aesthetics full time. Yeah. And then after that, obviously you need to continue to invest in yourself. So I have gone all over the country training. We will, when we know there's someone even from Europe coming in, Julia Horn, anyone that's coming in, we do try to make it a point to go to these conferences. We do cadaver labs as well to stay educated and learn anatomy and just to be safe really and give our patients the best techniques, the best, products, and really to be safe while we're doing it.
How do you know which conferences to kind of spend your money on?
I mean, you don't really know off the top, so sometimes asking people in the industry helps. I have done the AES the last several years. And I think for mid-levels or someone starting off, that's always the one I sent, my colleagues to, because I think it was a good start. They get to experience, they actually do have cadaver labs in that conference, but they have them all over the country. So if you're not necessarily in the Southeast and you're maybe out in LA or, you're in the West Coast, there are conferences that you can look into that are, hosted, I would say almost every month there's one.
Nice. Well, thank you so much for sitting down with me and speaking more about the aesthetic industry. Any last words for people that are in this community?
Thank you for having me. I appreciate it. I would say last words, definitely you have to invest in yourself. I think you have to set goals, and I think you have to believe in yourself. I will notice a lot of injectors take courses and they do invest in themselves, and then they take a course, but then they don't follow through and actually practice what they, just learned in a conference. So I say it's like riding a bike. If within the first 2-3 weeks, you're not really injecting, you're going to lose that new training that you just invested in. So it's really just opening up the accounts, getting the filler in your practice and really just starting to do it and having faith in yourself.
Yeah, for sure. Give everybody your socials and where they can find you.
So I am Jennifer Martinez. I'm here in SkinLocal. We actually have 2 locations in Pinecrest and Dayland. My Instagram account is jennifer.martinez.pa, and you can also find me at SkinLocal.
Awesome. Until next time. Bye.
Bye-bye.
The Aesthetic Talk Podcast.